And joining us now from Los Angeles, where the president is scheduled to appear tonight, Democratic Congresswoman Karen Bass of California. Welcome.
Thank you. Thanks for having me on.
Great to have you. And Congresswoman, I want to get to health care and the president's remarks on Iran, but I first want to ask for your analysis of the immigration situation. Now, the president said in his speech that there are Republicans in the House who want a deal. They want it to be piecemeal. How do we get enough of Republicans to say yes in the House to actually make a deal happen?
Well, I actually think that there are enough Republicans in the House right now who would vote on the Senate bill and we could pass it. The issue is the Speaker will not put it on the floor. So what worries me when the Republican leadership now says, well, we'll do it in a piecemeal fashion, what pieces are they talking about? We need all the pieces. My concern is the only pieces they're concerned about is border security. Where they have the biggest challenge is getting to the word citizenship and actually saying that, which is what a comprehensive plan has to include.
So wait, Congresswoman, you're saying that if the bill that passed through the Senate were to be put on the floor of the House today, you think it would pass?
Absolutely. I do think it would pass. I do. I think that he just doesn't want to put it on the floor because it would pass with majority Democratic votes and a number of Republicans who we know will come along.
Wow. Okay. Well, I want to move over to Iran because the president actually did begin his earlier remarks today on Iran. You sit on the House's Foreign Affairs Committee, so I want to ask you, first of all, just give me your analysis of the deal with Iran over its nuclear capabilities.
Sure. Well, I'll tell you that we had a briefing before I left in the Situation Room, and we were told about the agreement, and I think it's an important step forward. I think that a lot of misrepresentation is out there in terms of the sanction relief that Iran is going to have. It's a very small amount. It's about $4 billion of their own money that they will have access to. The majority of the sanctions will still be in place, and this is the first step toward a broader, comprehensive deal that is going to be negotiated over the next 6 months. So I think, I am in favor of peace. I want them to not have the nuclear capacity, and I think this is an important step forward.
All right, and Congressman, I can't have you on without asking you about health care reform, very important issue. And your state actually has been an amazing success. It's sort of been a model state when it comes to implementing the Affordable Care Act. The latest stats are showing that even with the month not even done, you guys have more than doubled the number of enrollees in California, and almost 1 in 4 of those enrollees are between the magic age, 18 and 34. So let me just ask you, in a state that's one of the 10 largest economies in the world, how's that working out for you, this Affordable Care Act?
Well, you know what? It's working out very well. And why? Because you have the leadership of this state that's 100% behind it. So I feel bad for my colleagues in states where governors are doing everything they can to block it. That's where you're having a problem. But my hope for California, since our population is so large, and it's larger than many states combined, that the volume in California will help make the program successful nationwide. I did a town hall, had over 400 people there a couple of weeks ago. We had a lot of people enrolled right on the spot, and it went very smoothly. So I'm optimistic for California.
And, Congressman, you obviously live in a blue state that is successfully implementing the Affordable Care Act, and your governor is obviously not fighting it. He's a Democrat. But sort of give me just for a second the assessment of your colleagues that are running in purple states or even in red states. Do Democrats on the floor feel that they can run on health care in 2014?
Well, I have to tell you that they're certainly disappointed with the barriers that have been presented so far. One is the website, but I think far more important than the website, it's the cancellations by the insurance industry. And I frankly think we need to put far more attention and pressure on the industry to not be an obstacle. Because at the end of the day, we know they're going to get 30 million new customers. That should be enough. But my concern is they want 30 million new customers with no regulation. So they shouldn't have their cake and eat it too. So my colleagues are very nervous about how it's rolling out so far, but they do feel that it's getting better, and I hope that this progress continues forward.
And Congresswoman, do your colleagues feel that the White House has been responsive enough to members who are nervous about their reelection and are nervous about the implementation in their states?
Well, I do think that the White House has been responsive, and I mean specifically, we've had several meetings, caucuses with representatives of the White House, the people who were involved with the website. So we've had a lot of contact. I do think they've been responsive, and the folks from the White House, just like all of us, were very upset with how the rollout occurred. And so So I'm hoping that things will get better. I am concerned about my colleagues who are from purple states, and then, of course, my colleagues who are from states where the governors are doing everything they can to block it. You know, we need to pay attention to the fact that they are blocking people from having access to health care by not signing up for the Medicaid coverage.
And, you know, Congressman, do you feel enough has been made of that? Because I feel like that point is not made a lot about the sort of recalcitrance of governors in terms of the implementation of ACA versus the site.
Well, I think several things haven't been talked about enough. That, you know, what is unprecedented about this is the hundreds of millions of dollars that have been spent by either the Republicans themselves or their supporting organizations to intentionally confuse everybody. That hasn't happened. I mean, they might have opposed Social Security and Medicare in the past, but I don't think they spent near the resources that they're spending now to keep everyone confused. And that's part of what is happening. And then you have the manipulation from the insurance companies, and then you have the governors who are doing everything they can to block it. So this is not just about a poor rollout with a website. This is a complex issue that has led to the problems involved with how health care reform has started.
A complex issue, well explained by you, Congresswoman.
Thank you.
Congresswoman Karen Bass, thank you so much for being here.